Welcome to the podcast Collaboration Over Competition. Today we are in Banff with Dr. Elizabeth Hall-Findlay, and I'm so honored to have her on my podcast. For the one who don't know, I did my fellowship here 8 years ago. That's why I'm so happy to be back here to be discussing breast reduction. So thank you to be part of my podcast.
Oh, this is fun. Yeah.
So it's a subject that we're both passionate about. So that's why it's so fun to have the expert about breast reduction to be discussing it. So let's jump right into it. Who do you think come to your clinic for breast reduction? Who is a great candidate?
You know, a lot of the patients, they all say that their biggest regret was not doing it earlier. So anybody who feels that their breasts are a burden, they're too big, they get in the way of exercise, they can't wear clothes that fit comfortably, people are always looking at their chest and not their face, and they just large breasts are uncomfortable.
And do you think there is an age limit? To do the surgery or?
No, I mean, my oldest patient was in her 80s, but she was healthy. And as you get older, your back can't hold things up as well. My youngest patient was 13. Admittedly, that's very young, but her breasts were down to her belly button. And I knew it was going to be more than once, but surgery is so safe nowadays. Why not? I mean, she was becoming a basement recluse. So doing breast reduction on her, I did her again. I took 1 kilo off each breast.
Wow, that's...
And she wasn't skinny, but she wasn't significantly overweight. And then at 17, I took another 700 grams and 400 grams. That's a fair bit. And I did a little touch-up for her to make it a bit better at 19. Why not?
Basically, no age. If you're healthy, you're good to go.
Yeah.
Perfect. And can you describe a little your specific technique that you've been using for some time now? And that's a technique I've been using too, and that I think a lot of other surgeons around the world are using it, and that we love it. So can you just describe a little?
Well, originally I had been using the standard technique, which has an anchor scar. So it goes around the areola or areola down to the crease underneath where your underwire goes, and then along the underwire. And some of those underwire type scars were quite thick. So I was trying to get away from that, just doing the lollipop around the areola and down. But it was more than that. I was now working with gravity rather than against it. The older way of doing that breast reduction was leaving the bottom and taking the top, which of course makes sense that that's not going to work out well with gravity over time. But the lollipop method not only had shorter scars, but because we're working with gravity, gets a better shape, more long-lasting shape. And if you have to add an anchor for lots of loose skin,
you
fine.
Can add it. But
you still get all the benefits of the so-called vertical or lollipop technique.
And over the years, did you change something in your approach about breast reduction, about the technique, or about how you manage your patient? Is there something that changed?
I've done different things over time. Like I've done group seminars to get patients all of the information because there was such a long waiting list. And that worked out really well. I even had a teenage patient talk to teenage patients while their mother talked to the parents. And
that's great. Yeah.
That worked out really well. I analyze my results. I keep looking at things. What can I do a little bit better? And I think that that's what's really been important for me. For example, that microphone, I'm using that to show whether I have a high or low footprint. And it was looking at photos and I could tell a patient, look, your breasts are attached low. I'm not going to be able to move your footprint up higher. So that was one of the things that, because I was paying attention to my results and analyzing things and looking at the photos, which is very interesting to do. But then I came up with it made sense. Some people's breasts are attached high and some low. And if you can manage patient expectations ahead of time, then it makes it way better for patients.
I think in surgery, one of the important parts is not only surgery, it's managing patient expectation. And in breast reduction, it is super important. As you said, if you have a low footprint, you're going to keep a lower footprint. So how do you explain that to the patient that you cannot change them completely? How do you make them understand?
I have what we call a footprint handout, and it explains for example, what is a breast reduction? What's a lift? Because patients will say, do I get a lift at the same time as a breast reduction? There's not something I can't lift the footprint, but there's not something I do differently, because removing the bottom with a reduction or moving the bottom with a breast lift, it's all about the bottom. And I don't add anything separate to the breast reduction to give the lift effect. Breast reduction by itself gives a great lift because it removes the bottom.
And it's a great lift, and it's mostly long lasting also, longer than if we add an implant.
So I go through the principles of breast surgery with the patient with photos so that they can understand where they fit into that whole scheme of things. And that really helps.
So yeah, I think every surgeon needs to be okay to be sharing picture with their patient, to be showing what they will maybe aim for as a result or not. So I think that's a great advice about managing patient expectations.
Yeah.
And the last question, more philosophical. If you could be one age for the rest of your life, which number would you pick and why?
Interesting. I think I would pick the age I am now, because I can look back on my life. Of course it's had its ups and downs, but you know what? It's all about curiosity. And if you maintain a level in curiosity, you won't get burnout. I know some people get burnout for other reasons, but I love what I do. I love trying to figure things out. And at this age, I've got all those things I have figured out already. So I want to keep figuring out more. So I like the age I'm at now.
That's a great answer. So that's it for the podcast on breast reduction. Thank you very much for sharing all your knowledge on nipple position and on breast reduction, and on welcoming me to your beautiful office here in Alberta. And stay tuned for the next one.
Well, thanks for coming. We really miss having you here.
Well, I will come back for sure.